appreciate the question about the scientific data around face coverings. So I'm getting my data and evidence from the medical advisory panel and the medical experts on that particular panel, as well as folks at the Oregon Health Authority, epidemiologists, and medical professionals. I also am seeing it in the reading I'm doing. We know that countries across the world that have a national response and are either ordering or strongly suggesting their residents to wear face coverings have been very successful in slowing the transmission and flattening the curve of the virus in those countries. And I'm happy to turn it over to our resident expert, Dr. Sidelinger, to give more details.
Thank you, Governor Brown. I think we have very good evidence from laboratory settings that different barriers can prevent the spread of disease, can contain the virus, such as the virus that causes COVID-19 behind that barrier. In addition, as Governor Brown said, in countries and communities where it's kind of the norm and that wearing masks in general in public is part of the response or is part of the culture in general, we've seen decreased spread of COVID-19, and that's regardless of some other policies. So those masks really do work to help contain the virus. Using a mask in this way is not foreign to us here in the United States. We typically do it in healthcare settings. If someone comes in who is coughing or otherwise showing symptoms of a disease, we will ask them to put on a mask while they're waiting in the waiting room and being escorted to their room. This is really an extension of that policy as we've learned more about the spread of the disease from people without symptoms. So we can't just ask people to stay home when they're sick, or if they go out when they're sick to go to the doctors to wear a mask, because we know some people aren't showing symptoms. So putting on this mask helps keep much of that virus behind the mask, so when they're out near someone, their ability to transfer that virus to someone else is much lower. So we're seeing more evidence of that every day from other countries, from other communities that have implemented this policy, and we hope that Oregonians will continue to heed our advice and take these steps to protect not just themselves and their families, but their broader communities.
If I could just add a little bit to that, I think some of the confusion and challenge around this is that people are out there looking for the study that shows that wearing masks is the one thing that's going to take care of this, or that contact tracing is the one thing that's going to, stop the spread of the virus, or testing is the one thing. There is no one thing that you're going to find evidence for that's going to say, if we only do that one thing, then everything is going to be fine. It's a layer of a bunch of things that we need to do. It's staying home when you're sick, covering your cough, washing your hands, answering a call from a contact tracer, wearing a face covering. All these things layer together. And so if you're out there looking for the study that's going to show you the one thing to do and proves that if only you do that, the problem's going to go away, you're not going to find that one study. And I think that's part of what drives some people's confusion.